Dr. Jonathan Tripp and I are talking off air and on air too about dental health today. And if you take a holistic approach to medicine, you realize that your dental health is also important to your overall medical health. A lot of people out there probably have heard stories about that, but it is something you can't overlook.
Yeah, we're going to talk about connections between kind of some pretty severe diseases and disabilities that go along with poor gum disease, what's called gingivitis or poor dental health in general. And so we titled today's talk as Health Dangers in Your Mouth.
And people generally think that all right, I brushed, I used a little scope, I'm fine, right?
Yeah,
And
or just a little scope, and that's not fine. So, yeah, no, I first will tell the personal side of this, the motivation behind this one today. Um, I have had, shall we say, good dental health for most of my life. I had wisdom teeth that came in on an angle and beat up the back molars and caused to where I had to have bilateral root canals in the very back bottom molars about 13, 14 years ago. And those root canals have done just great, and I have caps on those teeth and not really had any problem. And it turns out, probably for several months, I've had a problem there and have a cracked root to the tooth, which,
which would calcify, right?
well, no, it's actually just sets it up for infection. So you get an abscess that you don't even know about because there's no nerve sensitivity, and it's probably been there for several months, from what I understand. And at first, we thought, oh, we're going to be able to go back and redo the root canal and make everything wonderful. And once we got in and saw that there's really a cracked root, the only option for me is a tooth extraction, which I'm not very excited about. But it's caused me to think, hey, have I been running around with a low grade infection for months? And how has that affected my health? And will I feel better once I get that out? And I guess we're going to wait and see because, as Paul Harvey says, we'll have to wait for the rest of the story. But
I had that happen too, but my root calcified, and then I would just feel this tingling all the time.
huh,
And as a result of that, I had to have the tooth pulled. Now, we could have done root canal, but after it had gotten so bad that the decision was just made by the dentist, the tooth is going to come out.
yeah, no, and I'm not a fan of saying pull your teeth, but I am a fan of saying let's pay attention to what's going on around your teeth and the gums. There are certain bacteria that tend to hang out when the gums are inflamed, or they cause the inflammation, really. And we're going to talk about how that can lead to some pretty scary things, not just bad breath and bad teeth. So let's start off by talking about what the bacteria is. Um, in the We talk about plaques and things that build up on your teeth, and so getting routine cleanings is really important. But basically, it's not just coffee stains or cigarette stains. It really is a buildup that builds up on your teeth, but in the gums themselves causes inflammation, and that inflammation then can have bleeding gums or gum sensitivity or tooth sensitivity. And it's really a growing body of research that shows that the bacteria and the inflammation in your mouth are also linked to other problems. And here's some of them: heart disease. So we're talking about heart attacks, dementia, losing your memory and your ability to function on your own, and as well as your overall health. I'm going to talk about some of those others: diabetes, even rheumatoid arthritis. There's a connection between those being more prevalent if you have gum disease. So all of a sudden, we're talking about things that are health threatening and life threatening, all because we're not taking care of what's going on around our teeth. So,
A lot of people I know, I mean, they tend to neglect their. I worked with a fellow at the Postal Service, and when he would finish his lunch, we had half an hour. He'd take a little over 20 minutes, he'd go to the bathroom, and no matter what, he'd always brush his teeth, even at work, and then he'd floss afterward. He had great teeth. We also had postal workers had a great dental plan, and a lot of people don't have great dental plans, and they tend, I think, the dental health is something that a lot of people out there neglect more than anything else.
it is true. If you either don't have a dentist that accepts insurance or you don't have insurance, you're paying out of pocket for all of this. The doctors will often applaud the dentists and say, you guys were the smarter ones not to take insurance because now insurance rules everything about healthcare. Dentists are falling into that a little more because people are so accustomed to having an insurance plan. And so it is nice to have one. Um, I guess I'm going to argue for the dentists at this point, even though when I have to take, my four kids and my wife and I, and six of us are paying for teeth cleaning, that's a pretty expensive, week if we do it all at the same time. But what I'm going to argue for is the things that this can cause trouble with, not just pain in your jaw
Hmm.
or loss of teeth or looking bad when you smile in the mirror. We're really talking about things that will shorten your life or make your life much poorer quality. And so, I think it's worthwhile. And most of it really is doing what you're going to do at home that is low cost, and that is regular brushing your teeth, the flossing. And we were talking off air about how the flossing actually helps harden the gums, and the gums are your protection around the teeth. And so if you have soft gums, it's easier for bacteria to take hold and really set up shop and dig down and cause your whole tooth and other problems to show up.
We've got more with Dr. Jonathan Tripp on the way in just a moment. Coming up on 8:40, we're at 50. Bill Colley with you as well. It's Better Health with Tripp Family Medicine on News Radio 1310 KLIX and newsradio1310.com. Dr. Jonathan Tripp in studio with us this morning, and we're talking dental health on News Radio 1310 KLIX and newsradio1310.com. We're at 40 or 841. I can't confuse the time with the temperature. Temperature is actually, we're up to 52. Doesn't look great outside, but it's a little warmer today than probably what we were expecting for most of the week. Doctor, we've got to point out, I think you still have one peel party ahead
Oh,
before
we sure
the
do.
end of the year.
In fact, that's this next Thursday on the 9th of November. It is $100 to be part of the party. You will get more than that back, and it's a lot of fun. It's a chance to get kind of your feet wet, or in other words, more or less your hands and your face wet. Because at those parties, we do a hand peel. We're going to do some type of a facial peel after consultation, and then we talk about how to maintain things or actually reverse the aging process as far as your skin goes. And depending on your age, I can frequently will tell you 3 to 5 years we can take off over about 3 to 4 months. And a little older, I can often tell people we're going to take 10 years off the look of your skin, and that's without really the rest of the world even knowing you're doing it. There's no facelift. There's no the peels are not causing your face to truly peel like a snake, although we can do those. So if somebody really wants to be aggressive, we've got them, but most people don't want to do that.
I've seen people who've done that, and for a couple of months it's tough to look at, but when they
When they
get
get really aggressive stuff, yeah,
yeah, but then within a few
yeah,
months, they really enjoy what they've
yeah,
gotten done.
yeah. It is. There is the field of thought that says, no pain, no gain. We're kind of on the other side of that. We're saying, let's do this with virtually no pain and nobody else noticing and have all the fun and the benefits. And that's what the Peel Party is about. But we do a lot of other cosmetic stuff. That's part of my background for 5 years in Arizona is purely cosmetics with lasers. And in our office here, we don't have lasers, but we do Botox, we do fillers, the chemical peels, a nice, very fun treatment called micro resurfacing. And so if you got spots you're just sick of seeing, or you want to smooth your skin, you want it to look younger, healthier. Those are the things we go after, and it doesn't have to be just your face. We do hands, we do chest, but lots of this is cleanup. And I tell people this is for fun. It will not make you live longer, but you sure might like how you look better. So that's aside from what we're talking about with dental health today. We're really trying to talk about live longer, live better.
Well, and we're talking about gum disease too as part of this, which I think a lot of people out there may have it, don't even realize they have it. But the ill effects, the one that I think about most, is I learned about this 20 years ago, is if you've got bleeding gums, you likely are going to develop heart disease.
Yeah, the struggle with all of this is bleeding gums aren't usually just profuse. They're more you do a little bit like brushing your teeth or you floss for the first time in a long time. That's okay once or for 1 or 2 days, but really within about a week of trying to maintain once a day flossing, you shouldn't have bleeding gums. If you do, now it's time to actually see the dentist because there's usually a deeper problem, and that will cause you tooth loss. But what we're really talking about is if you have that gum disease long standing, you are a setup for more likely to have a heart attack, more likely to have a stroke, more likely to develop diabetes, and in long term, really, more likely to have dementia. And having two grandparents that had Alzheimer's in their late 80s, um, and then they lived into their 90s, dementia is a big worry for me. So when I, am confronting this as a possibility of an unknown, gum disease in my situation, um, I'm a little leery or concerned that, how many others have things like this and don't even know that it's going on. So, it is worth having the annual checkup, have somebody take a look that knows what they're looking at. But let me tell you a little bit about dementia. It's really interesting. This is uh, studies from 2009, 2011 in that neighborhood. So they're older, but not old. But we've known about them through that time frame. There is a type of, we now call it a bacteria, but it's a group of pathogens called spirochetes. And things that we know spirochetes cause are things like Lyme disease or syphilis. Those are two of the ones that pretty commonly people have heard of. But about 3 years ago, we discovered about, I can't remember the number, but six or nine new type of spirochetes where we only knew of about four. And these are really hard to see because you have to have super high powered microscopes. And it's not like the microscope I have in my office that I can look for, you know, red blood cells, white blood cells, things like that. These are really small. And the the interesting part about these studies showed that they can be harbored in the gums for especially people that have gum disease, and they believe that they seed into the or leak into the bloodstream. But the thing that really got me about dementia is a study done what's called post-mortem, meaning after people die, checking the brains of those with Alzheimer's, is they found that 80% of people with Alzheimer's had spirochetes or evidence of spirochetes in the brain tissue, whereas if you took the people who did not have dementia, about only 20% had spirochetes showing up. So there's a connection, but they can't say, hey, just treat the spirochetes with some antibiotics and you won't get Alzheimer's.
But when you bring this up, it's a little bit like somebody if you live downstream and they're throwing their sewage into the river, it's going to come by your home, and so if you got these in your mouth and that bloodstream comes by like the river, it's carrying it to the brain and heart and everywhere else in
Every
your
organ,
body.
yeah. Yeah, and so I don't want to put all my license and understanding on spirochetes and saying, spirochetes are the one thing in the world that is making everything bad. It's just, it's one more piece to the puzzle that says, hey, here's something that if you take care of your gum problems, take care of your dental, your mouth, oral health, you are less likely to end up at the end of your life not knowing who you are or who everybody else in your life is.
The other one you mentioned is a connection to rheumatoid arthritis, and uh, luckily, those of us who don't suffer from it probably have no idea what it's like. But if indeed it's related to your gums, people should probably consider much better dental care.
Yeah, rheumatoid arthritis can be pain that's inconvenient, or it can get as bad as being absolutely uh, devastating to changing the form of your hands, your joints, so you don't have good function. That would be severe rheumatoid arthritis. But just the fact that the gum disease has a higher likelihood to be associated with rheumatoid arthritis tells me, what we're saying is brush your teeth, floss your teeth, get an annual checkup. Boy, do I sound like a dentist, And but can I tell you if you have bad teeth, you're going to have rheumatoid arthritis? The answer is no. You specifically, I can't tell, but you're more likely to, and more likely to have diabetes. Let me talk about that one. Diabetes is really a devastating disease. Um, it speeds up the damage of pretty much every. And just one second, I tried to read right off of my notes here. Um, it speeds up the damage and eventual failure of your blood vessels, vital organs, nerves that cause poor quality of living and pain. Like if you've heard of diabetic neuropathy or peripheral neuropathy, we're talking about everyday burning or tingling or painful sensation to the feet or the hands, loss of vision because the small vessels get clogged off. It's like a heart attack on a small basis in your eyes, in your kidneys, everywhere in your body. And so you you are more prone to infections because you don't have good blood supply or not as you're more you are actually immunocompromised with diabetes. So imagine having bad gum disease, getting diabetes, and then the gum disease gets even worse because now you're more prone to infections. So they play together, is what we're saying. But you know, diabetes causes disability in loss of sensation. You can even lose fingers, well, mostly toes and feet, but that's due to that lack of circulation. But even death by heart attack, kidney failure is a big one. That's what my mom died of, is kidney failure due to uncontrolled diabetes, or even a stroke. So these are big players, and we're talking about maintenance. We're talking about taking care of your teeth, twice a day. Halloween is beautiful, but if you were still awake after the candy, brushing your teeth would have been a big deal last night.
I saw the kids. Some of them, they don't wait till they get home. They're eating it sometimes while they're going down the street.
Oh
Yeah,
yeah,
and so when they get home, they probably should brush right away.
yeah, and this is not to promote. I guess I don't think of myself as a germaphobe. If you brush your teeth every time you eat, you're the dentist's hero. I'm probably not that good, but if you're doing at least, morning and night, you're keeping most of the, as my wife calls them, the sugar bugs away that really set they set the environment for decay.
And in fact, I had a dentist friend from church who said the same thing. Just make sure you at least do it twice a day.
Yeah.
You wanted to point out that if you actually get this treated, that some studies show that people will actually
Feel better.
right.
Yeah, yeah, you get physically feeling better in a lot of cases. And can I promise that? That's why I said for me we'll have to wait for the second half of the story once I get my situation fixed. I'm kind of excited to see if all of a sudden I'm not aware that I was feeling run down and all of a sudden I have energy back. So I've heard that from others, but a 2009 study found that like people with the rheumatoid arthritis, they actually had less pain, less swelling, and morning stiffness after their periodontal disease was treated. So imagine that. It wasn't a drug, to treat rheumatoid arthritis that made them feel better. It was actually fixing, the gum disease. Um, and the tooth and gum disease mimic other pains. That's something that as a physician I have to figure out all the time. Somebody comes in with sinus pain or pressure or tooth pain, and distinguishing one from the other is kind of tough. But earaches, so ear pain, jaw pain, often headaches that are, chronic or recurrent, and even neck pain, all of them can be due to gum or tooth disease that if you fix the gum disease, tooth disease, these other symptoms disappear. Figuring out which one came first is the chicken or the egg story. We really are trying to figure out, did the headache cause this, or does the sinus pain causing tooth pain, or is it the other way around? And so, people that get the teeth fixed often find, I didn't realize I had chronic sinus pressure, or I thought was chronic sinus pressure, and now resolved. So that's the encouragement to take care of it, is maybe you'll actually feel better, and or if you have pain, jaw, ear, sinus pain, check the teeth out, see if they really might be the underlying
A
cause.
lot of times, people when they notice when the weather changes and they feel they've got a pressure headache from it, it might be related to dental.
Yeah, yo, very much so, or vice versa. In fact, that's one of my best hints. If somebody comes in, I'm testing for, do they have true sinus pressure, sinus infection, and I'll ask them, are your upper teeth aching? And usually it's not one, it's, yeah, the whole side or both sides. Well, it's unlikely that you had all of your teeth go bad at the same time. So that tells me you're fighting a sinus infection. But the reverse is true when they have a single tooth that's in trouble, especially the upper teeth. They'll often say, my I have this sinus pressure that I just can't get rid of and it just keeps hanging on. But if you identify the single tooth, that's really the problem, not the sinuses,
Hmm. Hmm.
because those nerves are so close.
You also wanted to mention how people can minimize the dangers, and we've mentioned obviously the obvious ones are brushing and flossing and doing those things.
Those really are. I mean, getting your teeth cleaned professionally on a regular basis. We've talked about, yeah, there's a cost that goes with that. That's the nature of taking care of your health. There is a cost. Um, but you could find out, the dentist is probably the best choice, but find out if you could benefit from what they call a sealer, a protectant coating, where they actually seal. It's called a sealant. Uh, it gets applied to the surface of the teeth, especially the chewing surfaces. Often we see this done with children, especially while they're still working through their baby teeth, so that they avoid the dental decay. Um, you know, Protecting those adult teeth as they come in. But
You referenced this, and dentists have that tool they use that just scrapes sometimes at plaque.
yeah,
And I got myself one of those too, so I can use that at home. Now, it's if you don't mind the scratching and the like, but it works. It's very effective at just cleaning the base of the teeth off.
I know if there's dental hygienists listening right now, they're cringing because I'm sure they've seen plenty of people get too aggressive with those and actually do damage to either the teeth or the gums themselves. I know people that do use those. They are scratchy, they are pokey, and you can hurt yourself with them. But at the same time, a little is good, a lot is not better. Meaning, if you did that lightly and you just kind of keep the plaque down, it's a beautiful thing.
Yeah, unlike trying to sand the body of the car or something, I'm a little bit gentler.
Yeah, yeah,
Yeah.
exactly. Yeah, yeah. The car you can bondo.
Yeah.
I guess the teeth you can too, but who wants to do that? So that's some good stuff. Well, if let me kind of go back to our peel party. Anybody that has interest in that or would like to, send their spouse, we'd be happy to have you. That's on the 9th. It's Thursday afternoon, evening from 3 to 6 p.m. And we'll have individual consultations. It's actually been a lot of fun. We did this about 2 weeks ago now, and just everybody that came through had a lot of fun with it because it's not threatening, and we're seeing immediate results, and those results just get better over a little bit of time. So you can call us at our office, 208 933 4400. That's 208 933 4400. Or you can also reach us through the web at trippvalleymedicine.com or post your comments and fun things on our Facebook page at Tripp Valley Medicine. But
You have a great line you got to recite here about your
okay,
conclusion.
yeah, no, this is part of my conclusion about what we're talking about with dental health, and that is, it says you don't have to brush all your teeth, just the ones you want to keep, and that's coming from the dental community. I didn't make that one up, but
Remember, he was vacationing in Britain a few weeks ago. He may have heard that there too.
that's probably true. Oral health is more than just a pretty smile. If you want to give yourself the best quality of life and the best length and avoiding potentially devastating health problems or early death, keep your mouth in good health because life's too short not to feel good.
I want to thank Dr. Jonathan Tripp for dropping by this morning. We're coming up on 9 o'clock news from the Fox Radio Network in just a moment. One more hour of top story is still ahead. I referenced in the first half hour of the show Dr. Ralph Peters and some comments he made about fighting terrorism overseas. We'll share some of that with you in the next hour of the show.